Fibroids are benign growths or tumors that develop in the uterus. They're also known as uterine fibroids or leiomyomas. You can have as few as 1 or as many as 100 fibroids, and they can be as small as a seed or as large as a watermelon. The growth of fibroids varies among women. Some women experience no symptoms at all, while others have severe pain and heavy menstrual bleeding. And for some women, the fibroids grow very slowly, whereas for others, they grow rapidly. But why do fibroids develop in the first place? That's what we'll be talking about in this episode of The Habits Pharmacy. Hi, I'm your host. If you're new here, welcome. Please subscribe. Now let's get into it. It's estimated that by age 35, 80% of women will have developed fibroids, with African American women being 2 to 3 times more likely to develop fibroids than Caucasian women. Unfortunately, there is no sure way to prevent fibroid development. However, we know that estrogen and progesterone play a significant role in their development. Estrogen stimulates the growth of fibroids, and progesterone makes them regress or shrink. It is believed that fibroids arise from genetic mutations of smooth muscle cells in the walls of the uterus. These cells begin to divide uncontrollably, resulting in the formation of a fibroid. Fibroids are usually seen in women who are overweight or obese. This is because estrogen is stored in fat cells, and when these fat cells have nowhere else to store estrogen, it gets dumped into the blood, which can lead to the development of fibroids. Also, estrogen dominance occurs when there is too much estrogen relative to progesterone, which creates an ideal environment for fibroids to develop and grow. Now, fibroids may cause no symptoms at all, but some women experience pelvic or abdominal pain, especially when the fibroids are large or multiple. Other symptoms include irregular menstrual bleeding, heavy menstrual bleeding, longer menstrual cycles, and sometimes a feeling of pressure or a dragging sensation in the lower abdomen. If you have fibroids and you're looking for a holistic approach to shrink them, here are 3 things you can do. Number 1, cut out all simple sugar and refined carbohydrates from your diet. Simple sugar and refined carbs are converted to estrogen in the body. Cutting these foods out will help to reduce excess estrogen and help to shrink existing fibroids. Number 2, eat more cruciferous vegetables. Cruciferous veggies like kale, broccoli, cabbage, cauliflower, and Brussels sprouts contain sulforaphane, which helps to detoxify excess estrogen. So eating more of these vegetables can help to reduce the risk of developing fibroids and may even help to shrink existing ones. 3. Drink nettle root tea. Nettle root is a natural diuretic and helps to eliminate excess estrogen from the body. Drinking nettle root tea every day can help to reduce the size of fibroids over time. Now, other than making these lifestyle changes, there are 2 medications that are commonly used to treat fibroids. The first class of drugs is called gonadotropin-releasing hormone agonists. These medications work by suppressing estrogen production. The second class of drugs is called norethindrone acetate. This medication works by blocking estrogen, and it also increases progesterone. There are certain foods that should be avoided if you have fibroids because they can make the fibroids worse. Number 1, dairy products. Dairy products contain growth hormone, IGF-1, which has been shown to promote the growth of uterine fibroids. Number 2, red meat. Red meat contains heme-iron, which is associated with an increased risk of developing fibroids. Also, red meat causes inflammation in the body, which can make fibroids worse. Number 3, alcohol. Alcohol consumption is associated with an increased risk of developing fibroids. Also, alcohol consumption causes liver damage, which can lead to estrogen dominance. Now, if you're finding this information useful, please click the like button below to help this information reach more people. And also remember to subscribe to the channel so you never miss any of our health tips. Thank you for watching. We'll see you next time.